Hey everyone, and welcome back to RAK Hospital podcast series. My name is Victoria, and I'm going to be your host. Today, we are going to discuss a very crucial topic that affects millions. However, it doesn't get attention that it truly deserves. You might think what that is. Well, wait no longer. It's skin protection and skin cancer prevention. Well, everything you need to know. I have two special guests coming here from RAK Hospital. We'll talk about the daily routine. We'll be talking about the UV radiation, everything you need to know to protect your skin. So, grab a hat, get into some shade, and stay tuned because your skin deserves the best protection. On my right-hand side, we have Dr. Dilruba. And on my left-hand side, Dr. Najam. So first things first, let's cut it short. We are going with the first question. What happens to our skin when it's exposed to the sun?
So, sun exposure induces several physiological and pathological changes that encompass both immediate and long-term effects. So, the immediate effects include sunburn, which clinically presents as redness and swelling, which manifests within few hours of sun exposure, and it can reach peak by 12 to 24 hours. And UV exposure also stimulates melanocytes to produce more melanin, and this darkening prevents from further UV damage. And also, this sun exposure facilitates the conversion of 7-dehydrocholesterol to pre-vitamin D3, which is essential for bone health and immune function. So, these are the immediate effects. And coming to the long-term effects of sun exposure, they are photoaging, which is caused by degradation of collagen and elastin, resulting in fine lines and wrinkles and leathery appearance. Also, long-term exposure leads to dark spots like freckles and lentigens and causes UV damage, this DNA damage. Leading to cyclobutane pyrimidine dimers that causes mutations, leading to skin cancers like basal cell carcinoma, squamous cell carcinoma, and melanoma.
You already mentioned their UV radiation, and I heard there are two types, UVB and UVA. So how about Dr. Najam?
Ultraviolet radiation is primarily divided into two types, that is UVA and UVB. UVA falls in the spectrum of 320 to 400 and UVB from 280 to 320. UVA is further divided into two, UVA2 and UVA1. Both are important because UVA it is primarily important for the immediate tanning that happens when we expose ourselves to the sun, and long-term effect is the photoaging and the permanent pigmentation, and then other mutations in the DNA and carcinogenesis. And UVB is primarily important in case of sunburn. You get the sunburn because of UVB, and this type of radiation is more important for carcinogenesis, for cancers, rather than pigmentation and other effects. One important thing is delayed tanning due to UVB. That is the tanning that occurs after 72 hours of sun exposure.
You already mentioned now something really important here. Skin cancer, how common is it today, and who is most at risk?
Yes, skin cancer is one of the most common cancers affected globally, and the incidence is increasing because of the increased UV exposure. And among the skin cancers, basal cell carcinoma is the most frequently diagnosed skin cancer, followed by squamous cell carcinoma and melanoma. The population at risk are people with fair skin, light hair, light eyes, who have less melanin, which has protective against this UV radiation. And people with family history of skin cancer, with personal history of skin cancer, and with immunosuppression. And with increasing age, the incidence of skin cancer increases due to cumulative UV exposure.
Okay.
So also men have more incidence of skin cancers due to occupational sun exposure.
Okay. It comes basically from work.
Yes,
right?
Yes.
Okay, yes, that makes sense. Okay, understood. All right. So, okay, we have the first topic here, the skin cancer. Now let's talk about the protection, because the first things that come to my mind, if it comes to skin protection, That would be a sunscreen, right?
Yeah, of course.
Yes. Okay. So, Dr. Najam,
Yeah.
what kind of sunscreen should we use? What is that, and how does it work?
So we have sunscreens, different types of sunscreens. I would say we have physical and chemical sunscreens. Okay, in physical sunscreens, when the sunlight is absorbed by the sun, skin, it is if you have put on a physical sunscreen, it will just scatter the sunlight and it will reflect it, so that the sun rays do not go inside the skin and damage it. Okay, in these sunscreens, we usually have minerals like titanium dioxide, zinc oxide, and then we have chemical sunscreens. In chemical sunscreens, there are certain chemicals that, absorb the sunlight and converts it into heat energy. That is not damaging to the skin. So here we have certain chemicals like avobenzone, then octoxinate. These are certain filters that we use. Then again, coming to SPF, that is the sun protection factor. That is how much UVB is absorbed by the skin when you put on your sunscreen. I would recommend at least an SPF of 30, because that would give you a protection of about 97%. That is, 97% of the sun rays will be reflected back. So 30 is good. However, if you have been working out in the sun for a long time, or you have certain disorders that make your skin more sensitive to sun, like SLE, then I would say an SPF of 50 would be good for you.
Oh, even 50.
Yeah, but something is better than nothing. So you can even go for SPF 15 if you do not want to go for 30 and 50. That would also give you a sun protection factor of at least 93%.
Okay.
This is important. 93% with just SPF 15. So this means something.
Well, ladies and gentlemen, this is a topic number one nowadays. So look, the summer is coming, and doesn't matter, when you are listening to us or where, but right now we are in the United Arab Emirates, and breaking news is now the temperature reaches 42 degrees. Yes, you heard me right, 42 degrees. But I think this is the right topic right now to discuss. We need to prepare for the upcoming season, and especially what kind of sunscreen we are going to use. Now, from my personal question, which type of sunscreen do you prefer? You mentioned these two types, the chemical one and the mineral, right?
Okay.
So from your personal experience, I think our listeners would like to listen to hear that.
So I would say it depends if you want to choose between the two. Both are good. It just depends on how you apply the two types of sunscreens. Okay.
Yeah.
So there are 4 factors that I would consider before recommending you a sunscreen. The first thing is effectiveness. Which one is more effective? See, if it is a physical sunscreen, it's going to give you more protection. But if you are going for swimming, let's say swimming, that time I would recommend a chemical sunscreen, because that gives you more protection. What is important about chemical sunscreen is that they blend very flawlessly into your skin, so it doesn't become very visible. You can wear it underneath your makeup and it won't be very loud. I would rather recommend them to use physical sunscreens, again, because they have lesser side effects as compared to chemical sunscreens, because chemical sunscreens sometimes they can cause photoallergic contact dermatitis, or they can just irritate your skin. So I would rather suggest to go for physical sunscreens in kids, children, and people with sensitive skin like rosacea. Then certain factors like environment. Chemical sunscreens have been banned in Hawaii. You know why?
No, I heard for the first time in my life.
Because it can damage the coral reefs, the coral life.
Okay.
So it's banned there. So
Makes
in
sense.
countries where they are very sensitive towards this issue, the role of physical sunscreens comes in.
You already mentioned that we would have to reapply the sunscreen. So how frequently should we do that?
So, sunscreen should be reapplied at least every 2 hours during continuous sun exposure and after swimming and after sweating. So, skipping reapplication definitely reduces the effectiveness of sunscreen, even if it's high SPF. So, if you're sweating or exercising or going outdoor for a long journey, it's always advisable to have sunscreens and reapply every 2 hours. Yes, sunscreen should be reapplied at least every 2 hours during continuous sun exposure and also after swimming and sweating. So even skipping reapplication decreases the effectiveness of sunscreen, even if it's of high SPF. So if you are going outdoor for a long walk, or if you're swimming or exercising, reapply sunscreen every 2 hours for its maximum effect.
It's important because even on cloudy days, about 80% of the sun rays, like UVB, it will just, come out. So, yeah,
80%
you're
it
still
comes.
exposed to
Oh my.
80% of the sun rays.
I.
Even when you're sitting indoors, some of it is going to come in. What is important here is UVA, mostly passes through glass as well. So, UVA more than UVB. Why is UVA important? Because it is the cumulative sun damage that matters in the long run. You know what happens? It just keeps on going, accumulating, and then at some point of time there is going to be some damage to your collagen, like Dr. Dilruba said. So that is where photoaging comes into play. Number one.
Oh my God.
Yeah. Number two is pigmentation. Like I said, UV rays, UVA, that can cause immediate tanning. And in the long run, they can cause pigmentary changes that can be permanent. That can be both hyperpigmentation as well as hypopigmentation. So these things can happen in the long run. Again, it is more important when another thing that I would like to mention here is when you're sitting in front of your screens, that we tend to do a lot these days. The blue light from your screens, they can also lead to pigmentary changes. So it's always better to wear your sunscreen even when you're sitting indoors, even when it's cloudy. I have patients coming to me with a lot of solar damage on their faces. They come to me and then they're like, I have this, please check it out. And then it is actinic keratosis, or sometimes even squamous cell carcinoma, sometimes melanoma. And then I'm like, what did you do to deserve this? They're like, yeah. And so the other day, a guy comes to me and he has many actinic keratosis, kind of squamous cell carcinoma, a kind of cancer, pre-malignant lesion, you could say. So I told him I told him what he had done to deserve this and all. He was like, he used to tan a lot when he was young. So tanning beds were a thing in US in 80s, 90s. He used to do it a lot. And then he used to burn himself at times. And now he was, bearing the repercussions now. So I'm strongly against tanning. Cumulative sun damage is one thing. It is mostly UVA that does it. And that leads to photo damage and, yeah, DNA defects.
Yeah.
So, but what we are talking about here is sunburn that is primarily caused by UVB. Sunburn is a very significant factor for the development of melanoma in the future. What is a sunburn basically? It is the inability of the skin to protect and to repair the damage that is caused by the sunlight. So the DNA mutation that happens there, it goes unchecked. And these mutations, they add up eventually, and that is what causes, I won't say what causes, that is what becomes an important predisposing factor for melanoma in the future. So even if you're using sunscreen after, the damage is still there. What you can do is be more responsible and keep on applying your sunscreen and take other important precautions in the future.
Okay.
So here I would like to add one thing. So in this in this scenario, what plays an important role is education about sun safety, especially in childhood, plays a very important role in reducing the skin cancer lifetime risk.
Yeah, definitely. Yeah,
Yes.
we need to learn from the beginning because
Yes,
this is
yes,
how
yes.
how we create our
Yeah.
strong habits, right?
Dr. Dilruba raised a very important point. You should start doing it when you are a child, nib they will in the butt.
So then, in this case, we would have to address this podcast to parents or future parents as well.
Yes.
Yes, definitely. Yeah. Okay. Are there any specific certain times in a day that we should avoid going to the sun?
Yes, definitely. Global dermatology guidelines even suggest to avoid sun exposure during the peak UV hours, that is from 10 a.m. to 4 p.m. So during these hours, the UVA and UVB exposure is at its peak. So seek shade during these peak hours, even on like Dr. Najam said, even on hazy days or even on cloudy days, 80% of UV rays can penetrate and harm skin. So it's advisable to seek shade during the peak UV hours, that is from 10 a.m. to 4 p.m.
Can you give us the red flags? Because, we usually don't check our skin every day. This is not in our routine. Okay, let's assume we already have this routine. We check our skin. What would be the first sign?
Okay. So I would broadly categorize the skin cancers in two categories. One is melanoma and other one is non-melanoma skin cancers. In non-melanoma skin cancers, we have squamous cell carcinoma, we have basal cell carcinoma. So there are certain things, but of course, they are not as invasive as melanoma. Melanomas are very dangerous if we compare them to non-melanoma skin cancers. So I would like to talk about melanoma first.
Okay.
There is this rule, ABCDE rule, when it comes to self-assessment of your moles. If you have moles, check the moles every day. It's better to take a picture in the beginning, then take pictures every 2 months, 3 months to look for any new moles. And if there's a mole, that if you already have moles, how can you assess them? The ABCD rule that I was talking about. A is asymmetry, as in the half of the lesion looks different from the other half. Okay. B is borders. The borders are blurry, fuzzy, or nodular. It's not regular. That's when you have to be alarmed.
Okay.
Then you have color. It's not just black or gray or brown. There are different shades of different colors in the lesion, in the mole per se.
Okay.
Then there is this duration. Diameter. How big the lesion is. If it is greater than 6 mm, be careful. Okay. Then you have evolution. How is the lesion evolving? For example, you have a lesion. What was the size like? Is there a change in size, color? And certain symptoms are very important in the evolution of the mole.
Mhm.
If there is itching or there is ulceration, it's bleeding, there's ulcer formation, be careful. That
Okay.
is an alarming sign. Go to
Oh,
your
wow.
dermatologist. Okay.
Wow.
Then, other than that, there's this sign called as ugly duckling sign. If you are someone who's blessed with a lot of moles, I've seen it in a number of patients, just see if there's any mole that is looking different from the others. If it's looking ugly, it doesn't look normal, go and get yourself checked. If you're about 30, you're developing new moles, be alarmed. Okay. So this was about melanoma. Now let's go to non-melanoma skin cancers. If you have a scaly red lesion on your photo-exposed areas, and it's been there since forever, it's not regressing, that is an important factor. Okay. Then again, you have a raised lesion, a non-healing ulcer that is not going away. You should be alarmed. Okay.
Wait, do you mean the redness on the skin?
A red scaly patch, if it is there
Okay.
and it's been there for a very long time, it's
Okay.
not going away, you're using a lot of creams, it's not going away,
Uh-huh.
you have to be alarmed. Okay. Especially on the photo exposed areas.
Yeah.
Photo exposed areas are face,
Yes.
ears, hands.
Yes.
Okay.
Hands, arms. Okay.
So, yes, and if there's a scar and you're developing an ulcer on a scar, again important. Yeah.
Okay, so we already spoke about the different types of skin cancer. Now, the question is to Dr. Dilruba, from your perception, how often should we get our skin checked by a specialist?
Yes. For an average risk individual, routine full body skin checks are universally not required. However, in individuals with over age 40 or with significant sun exposure, annual or once in 2 years skin checks are usually advised. And high risk individuals like with people with fair skin, light hair, light eyes, and with family or personal history of skin cancer, they should be checked or more frequently, like once in a year, or more frequently, like once in 6 months, based on clinical judgment.
Okay, so you already mentioned the light skin and light hair. So does it mean that people with darker skin have the lower chance of getting the skin cancer, Dr. Najam?
No, I would not say that. Even darker skinned individuals have a fair chance of getting malignancies. Non-melanoma skin cancers more than melanomas, though, because UV exposure, melanin in the skin, it gives you some sort of protection against the UV exposure. But it does not mean that dark skinned individuals do not have skin cancers. They do. And it's even more alarming. You know why? Because these skin cancers, they do not occur on the sun exposed areas mostly. It is mostly on the hidden parts. And people take it, they don't really think about it. They just let it be. And by the time we discover something is going wrong, it's already too late. This is especially important with a certain kind of cancer called as acral lentiginous melanoma. It occurs in dark-skinned individuals on the palms, on the soles, under the nails.
So now the next question from my end, because I heard so many times when I was a child that, we need to take a child, newborn, a toddler out for a walk to get some extra vitamin D coming from the sun, right? But what does it happen? What happens when we apply the sunscreen protection? Do we get the vitamin D or is it blocked?
So sunscreens theoretically reduce UVB exposure, which is necessary for the cutaneous production of vitamin D. However, most people do not use sunscreen thickly and uniformly enough to completely block UV rays. So as a result, some amount of UVB still reaches sun, which is allowing for the partial synthesis of vitamin D. So adequate vitamin D can still be synthesized while using sunscreen. Also, in individuals with risk of deficiency, supplementation is a preferred strategy rather than exposing to sun intentionally.
So I wanted to ask a little bit more about the skincare repair, especially after the sun damage. Are there any ingredients that will help us repair the skin?
Yes, you should look for certain ingredients in the skincare routine that can repair skin damage post UV exposure, like retinoids, antioxidants like vitamin C, niacinamide, peptides and growth factors, and some DNA repairing enzymes, which are included in like high-end anti-aging creams and alpha hydroxy acids. Among these, retinoids are the most proven topicals for reversing photoaging. So they just increase the cell turnover as well as stimulate collagen production that helps in repairing the skin by reducing fine lines and pigmentation. In addition to these, uncertain moisturizers containing ceramides and hyaluronic acid also support skin barrier function.
Wow. Okay, that's very important. We are preparing the list right now with all of the ingredients that we need. That was very insightful. Thank you so much. Do you have any advice, something insightful, what your patients would need to know before coming even to your office? Is there anything special that I would like to share with our people?
Yes. One core principle what everybody should understand about sun safety is it's not just the sunburn, but the cumulative exposure that causes skin damage. Like the incidental daily exposure, like sitting near the windows, walking outdoors, or driving, that causes this photoaging, pigmentation, and skin cancers. So, avoiding sun exposure during peak UV avoiding sun exposure during peak UV hours like 10 a.m. to 4 p.m., applying sunscreens regularly and reapplying every 2 hours will help you in protecting from UV damage. Also, using some skincare ingredients which can repair the sun damage, like I've already mentioned, like retinoids, vitamin C, niacinamide, etc. And in addition, having routine skin checks like self-examination once in a month and annual dermatologist examination just to just to know if there is like any chance.
Stay up to date.
Yes,
Yeah.
stay up to date and regular checkups of moles and to rule out any skin cancers.
Okay.
So wear your sunscreen, wear your protective clothing, and go out and shine.
Oh, go out and shine. Thank you so much for being here. So thank you so much. Thank you so much for being with us, for staying with us. Stay tuned because there's more episodes coming up. Thank you.